Hi, my name is Dr. Lena Edwards, and I am the Chief Medical Officer for Adrenalogix. I'm going to be giving you a webinar today on the gender-based differences in the stress response so that you can have a better understanding of why our products are so unique and why we are setting the trend for a change in the way that stress is managed now and into the future. The objectives of this webinar are going to be to review the structural and hormonal components of the stress response system. We're going to talk about the HPA axis and the HPG axis and the interrelationships in between those two hormonal axes. We're going to talk about the differences in the gender-based stress response system and how the HPA axis differs between men and women, both at basal conditions and in response to stress. I'm going to mention to you the clinical implications of these gender-based differences, and then we're going to talk about the products that Adrenalogix has created and how they have been specifically designed to address these gender-based differences in the stress response. First of all, let's talk about the structural and hormonal components of the stress response system, just to remind you of the basics so you have a better understanding as we move forward about the interrelationships and how these systems can become affected by stress and then also the superimposed influence of the gonadal steroids. So just to review, the central components of the stress response system are the hypothalamus and the pituitary gland. The hypothalamus secretes corticotropin-releasing hormone and arginine vasopressin, also known as antidiuretic hormone. These hormones then travel to the pituitary gland where they command the production of ACTH. And not shown on this slide, but also influential as a structural component that helps to regulate cortisol production by the adrenal glands, is the hippocampus. This slide discusses the different hormones and from where they emanate. So while we think about the hypothalamic pituitary adrenal axis primarily when we're talking about stress, this slide is basically meant to show you that the stress response system is actually comprised of not only the HPA axis, but also the autonomic nervous system, wherein is contained the sympathetic nervous system and the parasympathetic nervous system. And that side of the stress response system mediates the acute stress response, whereas the hypothalamic pituitary adrenal axis tends to mediate the chronic stress response. And that is the stress response that we will be focusing on in this discussion. Again, the HPA axis is primarily comprised of the hypothalamus, the pituitary gland, and the adrenal glands. And the primary hormones affecting the production of the subsequent hormone at each level are also shown on this slide. So CRH commands the pituitary to produce ACTH, which then travels to the adrenal glands to produce not only cortisol, but also DHEA, the primary hormone that is the anabolic antagonist to cortisol. So the metabolic effects of cortisol. Cortisol is a catabolic hormone. It is one of the primary catabolic hormones in the body, and it is designed to maintain and balance all of the anabolic hormones, which include such hormones as growth hormone, melatonin, progesterone, estrogen, and testosterone, as well as DHEA. Because cortisol is the prolonged fight or flight hormone, its primary purpose is to mobilize all essential and necessary resources so that the human body can mount a fight or flight attack. In so doing, such things as gonadal steroid hormone production, sleep, proper intestinal function, digestion, etc., fall by the wayside and become secondary to the importance of survival. So as you can see on the slide, bone tissue, muscle tissue will be broken down for fuel. Within the liver and other tissues, metabolic changes occur to promote the formation of fuel, whether it's as amino acids, fatty acids, or glucose. Immune system function is also affected, so that in the face of elevations in cortisol, Th1 is suppressed. However, if cortisol levels go down, Th1 goes up, and you have an increase in inflammatory cytokine production. The bottom line is, when human beings are subjected to the effects of chronic stress, no bodily system will function normally or optimally, and the major goal of the body will be to promote survival only, but not vitality, health, well-being, and longevity. It's also important to point out that cortisol serves another very important role besides that which it serves in the stress response. Cortisol is the primary hormone responsible for the evolution of and the maintenance of the circadian rhythm. And the circadian rhythm is primarily the diurnal release of cortisol, upon which all other cells, bodily systems, and organs depend. And it is around this circadian pattern of cortisol release that all other systems actually function. And so disruption in this pattern will create every single disease known to humankind. And can also have a drastic impact on health, wellness, and disease prevention. You can see that the primary time of cortisol rise occurs approximately 6 o'clock in the morning. It was released in a pulsatile fashion, which is why when looking at someone's cortisol levels, particularly when you're looking at their salivary cortisol levels, it's important that the collection occur over the first half hour or so upon awakening. That way you're not seeing just a peak or a trough within that 30 minutes where there's a sharp rise in a patient's cortisol levels. Now, many of us believe that endogenous HPA axis function is what it is, and it is not affected by other ancillary factors. However, this is very, very far from the truth. There are significant endogenous and exogenous factors which contribute to a patient's endogenous HPA axis function. These factors include age, gender, fetal programming, genetic factors, epigenetic factors, which are basically the changes in phenotypic expression of DNA material without there being any alteration in the DNA. Environmental factors such as drugs, whether they're prescription drugs or illicit drugs, toxins, pollution, demographic factors. Studies have shown that things such as socioeconomic status, occupation, social structural support, exposure to abuse of all kinds, especially if it occurs early in life, all of these things can also have a negative impact on HPA axis function. As can personality characteristics, coping styles, and even characteristics that are innate and unique to the stressor itself. So in evaluating our patients, all of these factors must be taken into consideration when trying to determine the baseline and stress-induced function of the HPA axis. For the purposes of this discussion, we are going to focus on the effects of gender on HPA axis function. So let's talk about how the HPA axis and its response to acute and chronic stress differ between men and women. So let's take a look at the hypothalamic pituitary gonadal axis first in the female, then we will look at the male version. And this is important so that we can see how this axis functions within itself, and thereafter we're going to talk about the relationships between the HPG and HPA axis in the female and male respectively. So again, like in the HPA axis, we start with the hypothalamus. And the hypothalamus produces GnRH, which commands the pituitary gland to produce both FSH, which is responsible for the production of ovarian estradiol, and LH, which is responsible for ovarian production of progesterone and testosterone. There are important negative feedback mechanisms within each of these axes. In the case of the female, estradiol feeds back to both the hypothalamus and to the pituitary gland to negatively inhibit its own ovarian production. And testosterone and progesterone feed back also onto the hypothalamus and the pituitary gland to limit their own ovarian production, thereby maintaining a system of checks and balances so that these hormones are not produced in excess or do not become deficient. In the male, The HPG axis is the same. However, obviously the end organ is the testes as opposed to the ovary. And the amount of hormone produced and the type of hormones produced differ. Obviously, in the male, the primary end hormone produced by the testes is testosterone. And testosterone does negatively feed back as well onto the hypothalamus and onto the pituitary gland. So this is the basic male HPG axis. Okay, now let's talk about the relationships between these two axes, because this is the basic fundamental reason why there is a primary difference between the stress response in females and the stress response in males. And that has to do with the relationships between the stress and the sex hormones in males and females. So just to review, HPA axis, hypothalamus makes CRH, which tells the pituitary to make ACTH, which then tells the adrenal glands to produce both cortisol and DHEA. The HPG axis, the hypothalamus produces GnRH, which then tells the pituitary to produce FSH and LH. And these hormones then command the ovaries to make estradiol, progesterone, and testosterone, although since this is not as important in the female with respect to our current discussion, I did not include it on the slide. Now, here are some very important feedback loops and relationships between these two axes that are the fundamental reason why the female stress response is different than it is in the male. Now, in both genders, cortisol negatively affects not only its own production at each level, but again, since it's designed for survival, it is going to turn off or negatively influence anything that is not considered essential for life. And clearly, when one is in a situation of fight or flight, reproductive mechanisms are drastically shut down. Not only that, but any female sex hormones that are present will be ineffective, because essentially the cells become resistant to the effects of those hormones, even if they are present. Cortisol inhibits reproductive hormones at every level of their production, at the hypothalamus, at the pituitary level, and at the ovarian level. Now, cortisol also negatively inhibits DHEA. And there's a very important relationship between these two hormones. Much like in a woman, maintaining estrogen-progesterone balance is important. In both genders, maintaining cortisol and DHEA balance is even more important. Cortisol is a catabolic hormone. DHEA is its primary anabolic antagonist. So if there is a discrepancy between these two hormones and cortisol levels exceed those of DHEA, patients will be in a chronic catabolic state with all of the adverse consequences thereof. Now, DHEA, again, is a negative, it's an antagonist of cortisol, and it will antagonize the effects of cortisol as well as the levels of cortisol. However, unlike cortisol, DHEA actually enhances the production and serves as a substrate for the production of estrogen, but also testosterone, which again is not shown on this slide because it's not as important to the female interrelationships between these two systems as it is in the male. Now, what about the reverse, the female sex hormones and their effects on the HPA axis? Estradiol actually stimulates the production of cortisol at multiple levels and in multiple ways. For the sake of ease and simplicity, I'll suffice to say that estrogen stimulates CRH production at the level of the hypothalamus. It also stimulates ACTH production. And for that reason, the overall impact of estrogen is to increase cortisol levels. Progesterone has the opposite effect and actually directly inhibits production of cortisol. Now let's talk about the male. Again, very, very similar to that in the female. Cortisol inhibits reproductive hormone production at every level of the hypothalamic pituitary gonadal axis. Again, it negatively inhibits DHEA, which reciprocates by inhibiting cortisol. In men, they have significantly higher levels of testosterone, and testosterone is a very potent inhibitor of hypothalamic CRH production. And it is by virtue of this fact that testosterone levels in men, again, since they're higher than they are in women, tend to suppress cortisol production. And that is one of the primary reasons for the differences between basal and stress-induced cortisol levels between males and females. So let's talk about the clinical implications of these gender-based differences. So in women, again, since women tend to have higher levels of stress, more symptoms from stress, they have higher levels of estrogen, which tends to increase both their basal and their chronic stress-induced levels of cortisol. They will have multiple different areas of dysfunction that will create all types of symptoms that can be misconstrued as a female hormonal imbalance. Many clinicians are inclined to replace female hormones in these situations, but it's incredibly important to understand the relationships between the stress hormones and the sex hormones prior to initiating any type of hormone replacement therapy. Because of these hormone interrelationships, women can experience infertility, menstrual irregularity, weight gain, sleep disturbances, mood disturbances, memory loss, low libido. And one of the things that's important to point out is that a female's menstrual cycle even is impacted and can impact the stress response. And it has been shown that the cortisol awakening response and salivary cortisol levels differ in women, whether they're in their follicular phase of their cycle or their luteal phase of their cycle. Now, the stress response is even more dysfunctional in women who are perimenopausal. In women who are in menopause, women who are in menopause tend to have more hypocortisolism. Polycystic ovarian disease, those patients tend to have significant difficulties and dysfunction in their HPA axis. Women with PMS and in women with endometriosis. In men, again, by virtue of the relationships between the sex hormones and the stress hormones, men can experience a decrease in their libido, many symptoms related to a decrease in DHEA and a decrease in testosterone. And this is extremely important to understand because men, especially if they are not in andropausal age yet, can have low or suboptimal testosterone levels unrelated to endogenous testicular function, especially when there is dysfunction within the HPA axis. So this is incredibly important to understand if you have a younger man who has low testosterone levels for other reasons, whether that be chronic stress, whether that be obesity, whether that be sleep disturbance such as sleep apnea. Simply replacing their testosterone without examining the HPA axis function and initiating therapeutic measures there can actually create a bigger problem rather than to solve the problem for which the patients are actually presenting. The same is true in females. So let's talk about some gender-specific stress solutions based on the information that you already have. Now that you understand that the HPA axis and the response of that axis to stress is very different in men and women, primarily because of the differences in their gonadal steroid hormone levels. Now, research has shown that there are some other reasons why there's a difference in the stress response between men and women. Some of it has to do with fetal programming in utero. Some of it has to do with a variation in the levels of ADH, as well as in cortisol binding globulin, which has an indirect effect on cortisol levels. There's also brain-specific sexual dimorphisms that account for these differences. But by far the primary reason for these differences is the impact of the gonadal steroids and the interrelationships between the gonadal steroids and the stress steroid hormones that account for these differences. It is with this understanding that we've created supplements that contain herbal preparations and nutrients designed to address these specific differences in men and women. Now, fundamentally, these supplements are also supposed to help the body manage the stress response. And again, this isn't treatment. These supplements are not meant to serve as the only therapeutic measure that is being undertaken. Because of course, if HPA axis dysfunction exists, yes, gender has an influence, but there are also always one or more secondary reasons for this dysfunction. And it is important that when you identify HPA axis dysfunction in your patients, that you always search for secondary causes. And there are many causes for HPA axis dysfunction. The reason for this webinar and the reason for our developing these products is to give you another tool in your toolbox to use with the understanding that gender plays a role and is profoundly influential in HPA axis dysfunction, but it should not preclude you from identifying secondary causes. Now, to the extent that HPA axis dysfunction is present in all of the patients that present with similar symptoms to these, all of our formulations include certain components that are designed to help maintain a healthy stress response. So all of the formulations include vitamin C, which has been shown to improve stress tolerance and to reduce stress-induced cortisol production. Pantothenic acid, which favorably modulates adrenal gland cortisol production and is specifically helpful in patients who have low or low normal basal cortisol levels. Pyridoxine, vitamin B6, has been shown to prevent adrenal gland hypertrophy, which can occur in patients who have chronic stress, and it also favorably modulates the function of glucocorticoid receptors. Our formulations also all include several adaptogenic herbs, and adaptogenic herbs basically function by helping the body maintain a healthy response to stress. So adaptogens do not make the HPA axis work more or work less or turn it on or turn it off. The whole purpose of adaptogens is to help the cells of the body withstand stress better by reducing the formation of nitric oxide and free radicals, and reduces oxidation, all of which occur within the cells during exposures to stress. So adaptogenic herbs actually help prevent cell apoptosis, DNA damage, and they help promote a healthy response to stress by the body. So if someone has a hyperfunctional stress response, adaptogens help to lower that. If someone has a hypofunctional stress response, adaptogenic herbs help to enhance that. Certain adaptogens raise cortisol uniformly. Others will lower cortisol uniformly. And because of this, those types of adaptogenic herbs have been avoided in these supplements because it's not always easy to tell if someone has a chronically hyperfunctional or hypofunctional stress response. So one of the adaptogens that is included in the formulations for both men and women is cordyceps. This has been extensively studied and has been shown to have significant beneficial effects in improving exercise tolerance and performance, cognition, sexual function, immune system function, and energy. Cordyceps has also been shown to be antiviral, antibacterial, antifungal, antiprotozoal, so many beneficial effects. And it's for that reason that it has been included in both of our formulations. Eleutherococcus, which is Siberian ginseng. Again, lots of studies to show its improvement and its benefit with respect to stamina, endurance, cognition, immune system function, and energy. It also functions as an anti-inflammatory, an antioxidant, an anxiolytic, and an antidepressant. Rhodiola, again, very similar with respect to its beneficial effects. And it has been extensively studied as well. If you look at the side effect profile of these three adaptogenic herbs, it is minimal to negligible. And it is for that reason also that we have included these particular adaptogenic herbs in our formulations. Now let's talk about each specific formulation and the components therein that have been added specifically to address the gender-specific differences between men and women. So Adrenafem is the formulation for women, and it has been designed to help the female stress response system and reproductive system during periods of chronic stress, but also during times of hormonal transition. Again, based on the understanding that there are significant relationships between the HPA axis and the HPG axis. With this understanding, Adrenafem also includes ashwagandha, which carries with it the benefits of all of the other adaptogens of which it is a family member. However, with respect to females in particular, it has been shown to enhance sexual function and also to reduce breast cancer because of its favorable effects on estrogen receptor alpha, which is one of the two types of estrogen receptors which has been shown to cause proliferation of breast and endometrial tissue. Ginkgo has also the beneficial effects of other adaptogens. It is as well as it is an adaptogen as well. However, it also has been shown to improve symptoms of PMS, improve sexual function, and improve symptoms of fibromyalgia, especially in females. And fibromyalgia has been shown to occur with a significantly higher prevalence in women than in men. And there is an association between fibromyalgia and abnormal cortisol levels, usually low cortisol levels. L5-MTHF has also been included. Now, MTHFR is a genetic mutation that many of you should be aware of. It is very, very prevalent in our population and obviously is found in both men and women. However, we have chosen to include it in this supplement because it is particularly important in women who are of childbearing age because of the incidence of folic acid deficiency and neural tube defects. MTHFR mutations have also been shown to be tied to cardiovascular disease as well as mood issues and clotting disorders. Again, sometimes more common in women than in men. Adrenafem also includes diindolylmethane, DIM for short, which has been shown to promote favorable estrogen metabolism. And then it's also been shown to reduce the risk of ovarian and breast cancer and also to reduce the symptoms of endometriosis. Black cohosh has been included in small amounts because it has been shown to help improve the symptoms of female hormone imbalances related to PMS, perimenopause, and menopause. It's also been shown to improve painful menstruation. It's an anxiolytic, it improves sleep, and it improves bone health. Some of the reason why it is believed to help improve hot flashes is because it also helps to inhibit serotonin reuptake. Again, not just for the hot flashes, but also for the mood. The black cohosh has been found to be helpful. And finally, diosgenin, which is basically extracted from wild yam and basically has within it a natural form of bioidentical progesterone. And again, studies have shown for it to be antioxidant and anti-inflammatory agent, anti-cancer, especially there's studies showing it to be anti-breast cancer. And so for those reasons, it has also been included in this supplement. Many female patients experience progesterone deficiency either because of lack of ovulation or ovulation with insufficient amounts of progesterone produced, or they're estrogen dominant for a variety of different reasons, whether it's dietary or related to obesity or endometriosis. And that's one of the major reasons why this particular herbal agent has been added to the Adrenafem supplement for women. Ideal candidates, really any woman over the age of 18 or who is not pregnant. So specifically, if you have a patient who is is being subjected to chronic stress, and again, that does not just have to be psychological. If they have eating disorders, if they have nutritional deficiencies, if they have toxic exposures, if they're unable to detoxify, there's a variety of different reasons that female patients can have HPA axis dysfunction. And the extent to which HPA axis function is affecting HPG axis function will then determine whether or not your patient is a suitable candidate. for the supplement. It's specifically helpful in women who are having stress-induced menstrual irregularities, stress-induced infertility, of course making sure that other causes have been ruled out, but actually HPA axis dysfunction accounts for 1/3 of causes of all female infertility. Women who are in perimenopause, menopause, or who have polycystic ovarian disease or endometriosis, simply by the virtue of the fact that they have these female hormone imbalances, these patients have a higher incidence of HPA axis dysfunction. And so the supplement works extremely well in those patients. It's also a very excellent supplement to consider in women who are experiencing the female climacteric or other female hormone imbalances, who either do not wish to use hormone replacement therapy or who are not candidates for bioidentical hormone replacement therapy. This supplement works incredibly well. Dosing guidelines are included here for you. PMS, typically we give our patients 1 capsule in the morning, days 12 through 26 of the cycle. It's important that the dosing not occur past 5 or 6 o'clock in the evening, because some of the vitamins can actually increase levels of energy and so may interfere with sleep. That does not happen in all patients, but it's something to be aware of. In patients who tend to have more HPA axis dysfunction, you can certainly be more liberal with your dosing. The max dose is 1 capsule twice a day. And again, these are different options for you to consider using based on your individual patient symptoms and individual patient needs, and obviously symptoms as well as blood work results and saliva test results. With respect to the safety profile, again, we've taken extra precautions to make sure that nothing in the supplement carries any adverse side effects. There are no herb nutrient interactions, and the only herb drug interactions have been listed here for you, mainly with Siberian ginseng and ginkgo in patients who are on cardiac medication, digoxin, or if they take blood thinner. One other thing that you should be aware of, though, is in animal studies, the ashwagandha or withania has been shown to increase conversion of T4 to T3. So just be aware of that in patients, especially if they are on thyroid medication, and monitor their thyroid hormone levels appropriately. And also, the use of this supplement may either completely alleviate your patient's need for hormone replacement or result in a reduction in the dosing. So just keep that in mind, because obviously once you start improving HPA axis and HPG axis function, the requirement for hormone may go down. Also understand that it's important to not start with hormone replacement therapy right away. Because again, especially in younger patients or patients who have some of these other issues like PCOS or endometriosis, there are other things that need to be undertaken and tested and treated before simply resorting to hormone replacement therapy. And using Adrenalogix in this context can be very, very helpful. Now, Adrenalogix, talk about some of the unique ingredients in this supplement that differ from those that are in the Adrenalogix product. Adrenalogix contains maca, again, another adaptogenic herb, which has been shown to display all of the benefits of the other adaptogens. However, specifically, it's been shown to improve a sense of well-being and sexual performance in men, as well as sperm quality and sperm count. Panax ginseng, again, another adaptogenic herb, so therein has all of the benefits of the adaptogens that we've already discussed. However, it's also been shown to be neuroprotective, cardioprotective, and it also enhances sexual function and favorably modulates glucose regulation. We've included saw palmetto as a measure to help promote and maintain prostate health in men. Tribulus, which has been shown to improve sexual performance and erectile dysfunction through a mechanism believed to include increasing levels of nitric oxide. Urtica dioica, which is stinging nettles, is an antioxidant as well as an anti-inflammatory, but specifically improves prostate health, helps to improve benign prostatic hypertrophy, and in general has been shown to help support bladder and urologic health, especially in men. And finally, zinc has been included, not primarily as an immune system enhancer, which it is, but mainly because of its ability to inhibit aromatase, which will then secondarily improve testosterone levels. In men, alcohol consumption, chronic stress, elevated body weight, liver dysfunction, and other things can actually increase conversion of testosterone into estrogen. This also tends to happen with age. And so zinc has been added to help prevent that conversion. So again, testosterone replacement therapy may not be advised, especially in men who have some of these predisposing factors to testosterone conversion into estrogen. Rather, you may want to consider using the supplement to help the body improve sex hormone levels naturally by addressing some of the underlying issues rather than simply band-aiding the problem with testosterone replacement. Again, this is very patient specific and relies upon an additional workup and other lab testing. Ideal candidates, again, we have advised basically not using this in patients less than the age of 18. But basically any man who has a low testosterone level, especially if it's secondary to chronic stress. Men who tend to overtrain, this is a huge problem. Overtraining syndrome tends to cause significant HPA axis dysfunction with resulting gonadal steroid hormone deficiencies. The solution is not to replace gonadal steroids. The solution is to correct the HPA axis dysfunction. And this supplement is very helpful in this regard. Men who suffer from infertility, again, as long as other workup has been negative. In older men who may be receiving testosterone replacement therapy but do not derive enough benefit from that alone, symptom speaking. And then also men in whom testosterone replacement therapy may be contraindicated, such as those who've had prostate cancer. Here are dosing guidelines again. This is just a basic general overview for you. The maximum dose of Adrenamen is 2 capsules twice a day, but certainly gauge this based on the age, clinical symptoms, and lab results of your patients. Because Adrenamen contains Panax ginseng, it is advised that the patients take their second dose no later than 5 p.m. Because it can cause some insomnia. With respect to safety, again, excellent safety profile, and only may cause issues in patients who take digoxin or Coumadin. So use caution in patients who are on these 2 types of medications. We are extremely proud to be the only company that has developed gender-specific supplements designed to address HPA axis and HPG axis dysfunction. Our plan is to continue developing additional products with the understanding that many types of unique factors affect the stress response system. Our initial offerings are based primarily on the gender-specific differences. However, we hope to expand our line of products to include other unique factors that affect the stress response. One size fits all is now obsolete, and the time has come to start thinking about how we manage stress in our patients very, very differently. Please keep in mind that this supplement is not meant to serve as monotherapy. Lifestyle modification, dietary modification, stress management techniques, etc., are also extremely important and vital to the process of improving HPA axis and HPG axis dysfunction. We have developed this line of supplements simply as a tool to help you as an ancillary therapeutic measure when working with patients that have HPG and HPA axis dysfunction and the associated symptoms thereof. The final slides include scientific references, which are also available elsewhere on our website. Should you have any additional questions, comments, or concerns, please feel free to reach out to us by visiting the Contact tab on our website. Thank you for your attention, and I look forward to working with you and look forward to all of your patients benefiting from these 2 unique revolutionary supplements.